demonstration is for placing a muzzle on a dog. So we have a commercial muzzle here, and with my right hand I'm going to hold the muzzle in my hand, and I'm going to hold the dog's mandible as such. With my left hand I'm going to grab the other strap, and I'm going to hold the dog, I'm going to point the dog's nose up to the ceiling. Now with a swoosh movement, I'm going to attach the muzzle, and I'm going to secure and fasten the buckles in the back with a secure. Using a restraint pole, you want to use this as last resort when you cannot capture an animal. So to make your loop bigger, you want to pull up on the release and pull the cable down as such as I'm making my loop bigger. And to make it smaller, I pull the loop as such. Now I would go to the animal, and I would capture the animal around its neck and tighten it so the animal cannot get out. Now when I need to do a quick release, all I do is pull on the cord right there, and it releases the animal wherever I need to release it to. This demonstration is on restraining a cat by wrapping the cat in a towel, the burrito style. So we have our cat here, and we're going to take the end of the towel, and we're going to wrap it up. Then we're going to wrap the cat like a burrito. And then we're going to wrap the other end. So by doing this, we have restraint of the cat. We could carry the cat around. All right, we're going to do a urinary catheter to obtain urine from this male dog. And we're going to start off with cleaning the exterior on the sheath with some Chlorhex. And we're using sterilized gloves. So now we're going to exteriorize the penis. Okay.
And then you can hold it there with your left hand.
Okay, now I want to clean it with some chlorhexidine scrub. Okay. Now we replace our lubed, sterilized French catheter in, a 10 French. And there's our urine. And it is dark. And there we go. Now we slowly pull it out. And that's the urinary catheter procedure. Okay. We want to let it go some out, and we're actually catching some. Okay. We just collected this urine sample from Skipper, and I hope I was able to demonstrate the importance of a midstream catch. What you do is you actually, as the dog is urinating, you let some of it out to avoid possibly as much contamination as possible, and you try to collect your urine sample midstream as the dog is urinating, and then you test it as quickly as possible, because bacteria does reproduce very quickly, and we want to avoid any unnecessary contamination. I'm going to press my area, my bladder, which is a nice full bladder. I'm going to go into the bladder and draw out some urine, which is nice and yellow and clear. Very good. That's it. Pretty cool. This is a demonstration of anal gland expression. So here's a dog's anus, and the glands are located at 4 and 8 o'clock. So I want to use a cover, lift the tail up, and I'm going to press in and up. And see, we got some anal gland expression right there. So in and up. It's like milking cow. He's not too full. So we just got a little bit. I'm gonna make sure it's covered because it does squirt out. Okay, so we got a little bit of anal gland fluid, and that's it for this dog. Boy. Okay, so again, we're going to, now he has black nails, so we want to be very careful as to get into, we don't want to get into the quick here. So we're just going to clip our tips off here. And it is harder to see with black nail dogs. Kind of just get an idea of how far to go down because you can't see the blood in the nail bed. So you really got to be very careful with that. So, good boy. Okay. And so now we got one more to do. There's 1, 2, 3, 4, and 5. Okay, he did excellent. I have my little nail trimming scissors, and I also have some quick. That's just in case I go too far up on the nail and it starts bleeding. I want to coagulate that quickly so we don't lose too much blood by that process. And I put a little bit of quick into a little cup here, a little cap, and this way I can dip the nail in there. So what I do is I'll restrain the animal like this, and then I will take my little scissors and I'll just start clipping away. I want to clip away at the tips of the nails as to get the sharp points off. And it is beneficial for everybody by doing this. And if you press on the nail itself, with the cats, it retracts them out. Okay. So, hopefully you can see that. We got one paw done. Now we'll move to the other paw. We're pressing on the nail itself to retract it out, and so on and so forth. It's okay. And you also want to talk to the animal and reassure the animal. This demonstration is on hand pilling a dog. So we're going to hold the muzzle into a neutral position. We're going to hold it back, and I'm going to have the medication in my hand to administer, and I'm going to drop it in the back of the mouth and close the muzzle. Now the animal swallowed right away and took the medication. If the animal did not swallow right away, what we could have done is we could have tapped on the nose, we could have blew into the nostrils, and we could have rubbed under the chin, all the while holding the muzzle closed. This demonstration is for the administration of a feline cat pilling. So what we're going to do is we're going to extend the head all the way up so that the nostrils are pointing toward the ceiling. We're going to take our medication and we're going to put it as far back into the pharynx as possible, close the jaw, and do scratch underneath the chin and see if the animal will swallow it. Okay, so take the head, move my medication over, all the way over toward the ceiling. We're going to open up the jaw and put the medication all the way to the back. Then we're going to close the jaw. It's okay, baby. And we're going to swallow. Okay. And there it goes. The animal licked its nose, and that ensured us that the animal did swallow the medication. We're cleaning a canine's ear and applying medication. So we're going to first of all, I want to let you know that the vet has already ensured that the eardrum is intact in the dog still. So that's important when applying the medication, so that the eardrum needs to be intact still. Okay, so we're going to take our air cleaner and we're going to take the dog's ear and pull it back and up so as to have access to the ear canal. So we're going to apply a liberal amount of the ear cleaner, it's okay buddy, into the dog's ear, and then we're going to rub the base of the ear and kind of squish it around as to remove the debris and anything in the ear. Good boy, good boy. Okay, so then with a dry gauze, we're going to again pull the ear up and back, and we're going to just clean it out a little bit like that. Good boy. Okay, and when it's time to, and you may want to repeat that another time depending on how dirty or how much crud is in the ear. So when it's time to put the ear medication in, we have a product here called Malotic, which is an anti-inflammatory, antifungal, and antibacterial agent. We're going to apply this twice a day for 7 days to get rid of anything the dog may have in the ear. So what we do again is we pull the ear up and back. Good boy. Put your head this way. And then we're going to allow 4 drops of ointment into the ear, like that. Good boy. Stand up. And then we're going to mix it into the ear as such. And that's it. So I'll put a little bit of the ear cleaner in the cat's ear. Okay. Now I'm going to rub the base of it, and I'm going to just massage it. Okay. Now, I would do that a little bit longer if I was doing that, but for the sake of the video, I'm going to now take a cotton and I'm going to just clean it. And then I can take a Q-tip. I'm not going to go in the ear. I'm just going to go on the outside part with a dry cotton swab and get all the crevices, get all the crevices in the ear to clean it out like that. Okay? To avoid going in the ear canal. I don't want to do that. Okay, so I might repeat that process another time depending on how dirty the cat's ear is. But right now I'm going to add the medication. So I have ear mite medication here. And again, I want access to the ear canal. And it calls for 4 drops. 1, 2, 3, 4. Okay. Now I want to massage the medication, or I want to massage at the base of the ear. Like that. Okay, and I'll repeat it with the other ear. But that was a demonstration on cleaning a cat's ear and applying cat medication. This demonstration is on the application of a topical flea and tick medication. We're going to be using the product Pet Armor Plus, and the active ingredient in this product is fipronil and methoprene. And how we do this is we're going to start off by cutting the tip of the pipette with the scissor. Then we're going to take the animal, and for this product, we're going to apply it to the middle of the shoulder blades. Stay. We're going to first locate the shoulder blades. We're going to part the hair. Look this way. Okay. We're going to part the hair, and we're going to let all the medication out into one spot. And for this medication, for this manufacturer, that's how we do it. We administer this medication. Now, we put it in between the shoulder blades for a few reasons. 1, it prevents the animal from licking it off, and 2, that's because the manufacturer recommends it to be that way. That the medication is absorbed into the skin, and then it becomes part of the sebaceous system, and it is those body oils the sebaceous system produces natural body oils. It is those body oils that will distribute that medication throughout the animal's entire body. And this will usually take around 24 hours to complete that. And this medication has to be repeated every 30 days, and it is waterproof. Demonstration on oral gastric intervention tube. And you may talk.
So the first thing that we need to do is measure the tube. So we start from the incisors and we measure to the last rib. And that will be the length that we need to pass the orogastric tube so we can ensure that it is in the stomach. So you normally mark the tube with something that you can hold on to so you know the distance to go. Then you'll open the mouth and insert the tube and follow it down and ensure you're in the esophagus and push to the length where you just measured to.
Right. Okay, now we're going to perform the Cheyenne eye test to determine if the animal has dry eye. Hi, sweet pie. Okay, we're going to put the little test strip underneath the bottom lid of the animal's eye and keep it closed. And we want to keep it there for a minute. It's good, girl.
Bird bone.
Okay.
Narrow.
And let's take that out. Ooh.
Question. Seen a picture of it in the book.
I guess as long as it
I guess
fits,
we
right?
have a dry eye.
Dry.
This is a demonstration of fluorescein stain to the eye. We're using a cat today, and we have a impregnated strip here with fluorescein stain on there. So what we do first is we're going to put a drop of sterile saline onto the end to activate the stain. Then I'm going to touch the strip to the corneal of the eye and allow the animal to blink a few times to activate the stain. Okay, now what I'm going to do is I'm going to rinse the eye of any fluorescein stain that did not go into any lacerations or any abrasions in the eye, because we want to get rid of it. So I'm going to rinse the eye with some sterile saline. It's okay. Cats do not like liquid. Okay, so now I'm going to dim the lights. It's okay. Okay, so now we're going to reveal if the cat has any abrasions in the eyeball. And by doing so, we would see it here in the eye. We would see the stain would have seeped into any lacerations or any ulcers that the cat have, and all I see is just excess green stain. Okay. A tonometer is an instrument used in veterinary ophthalmology. What it is a handheld instrument, and it applies pressure to the eyeball to the animal. And with that, you can determine, or the vet can determine, if the animal has an increased pressure, which should therefore indicate glaucoma or another eye disease of that sort. So our vet clinic does not own a tonometer, and I cannot demonstrate the usage of a tonometer. This demonstration is for the administration of an enema on a dog. I'm going to make up an enema consisting of warm water and a few drops of Dawn soap, just like you would making a baby's bottle. Okay, I have a container here, and I'm going to add warm water. I'm going to add 2 drops of Dawn soap. 1, 2, it's about 2 drops. Take a couple applicator sticks, and I'm going to stir it. Okay, just to mix it up. Okay, I have a 60 milliliter syringe. I have a red rubber catheter, and I have some lube. So as I can put that on the catheter, I'll insert it into the animal about that much. Catheter tip syringe, and I'm going to draw up my enema. Oh, I just love new syringes. Okay, I'm going to wipe that off. I'm going to open up my new catheter. And I'm going to place it on the end of my catheter tip syringe as such. Okay, there's my enema. And I'm going to put some lube here, my paper towel, and I'm going to put it, add it to the tip of my red rubber catheter. Okay, so I'm going to prepare the animal, and I'm going to pause my tape while I'm doing that. So now we're going to insert our catheter gently into the rectum of our dog. Now it's a natural response for him to be going in and out like that. We do not want to go fast. We do not want to cause any sort of trauma. Okay, so at this point, that's about as far as I would go, and I'm going to administer the enema at this point to the animal, but I'm not going to do that because this animal doesn't need one. But if I was, that's what I would do, and I would do it very slowly as to not cause any trauma to the animal. So I'm going to slowly pull it out, and that's it. This is a demonstration of subcutaneous fluid administration. Now, this can be done a few ways. We can hang a IV bag and attach it through an IV line to the animal and insert a needle and changing out the needle each time it is a different animal, and we can insert it that way, or we can use a syringe. The preferred site for subcutaneous injection for fluids is on the dorsal lateral sides, so on the top of the animal on the sides, and per location you never want to exceed 50 to 100 milliliters per site. And the fluid of choice is going to be an isotonic solution of fluid like lactated ringer solution. So I'm going to pause the video and get an animal ready and demonstrate how to do a subcutaneous injection. All right, step one is I'm going to choose my site, and I'm going to alcohol a little bit of my site. Then I'm going to tent the skin. I'm going to take my fluids. I'm going to insert it into the animal. I'm going to pull back a little bit so as to make sure I am not, and you cannot see that, there you go. I am not in the vein, or I am not in a vessel, which I'm not. So I just pulled back. Now I am inserting the fluid by pressing on the plunger. And just for the sake of this video, I only administered 5 milliliters of lactated ringers to show how to administer subcutaneous fluid. Now I'm done, and I'm going to just slightly press on the little area not to expel any of the fluids that I just inserted into this animal. And this is a demonstration for a modified Robert Jones bandage. Okay, step one we're going to do is we're going to apply our stirrups with our tongue depressors. So I apply my tape to the dog's leg, and I'll attach the end part to a tongue depressor. Then I'm going to follow up on the other side of the leg. Stick that to a tongue depressor. Okay. My first layer is going to be cast bandage, and I'm going to wrap from distal, proximal, just above the elbow, and I'm going to leave 2 nails exposed so I can check the bandage for any wound, any swelling of the wrapping here. As I wrap the leg, I'm going to overlap each wrapping with over 50%. Okay, and I'm going to not do it too tight, but I am going to apply some pressure, but not too tight because I don't want to stop the circulation of the dog's leg. Second layer is going to be conforming gauze. Again, I'm going to go from distal to proximal, and I'm going to leave those 2 nails exposed, overlapping 50%. Now this one you got to be very careful with because you can apply a little bit too much pressure with the conforming gauze. So you want to apply pressure so that you have some stability, but you don't want to apply too much pressure to the bandage because you don't want to stop circulation. Now my next step is I'm going to bring my stirrups up to the bandage. Okay, now I'm going to follow up with my last wrapping of vet wrap, and we have this cute little paw vet wrap. Now, when you come up to the top, you do want to have about that much of your previous layer exposed for the comfort of the dog, and also you don't want it gathering. This is a demonstration on the removal of a modified Robert Jones bandage. So I'm going to take each layer off, and I'm going to just go in reversal of putting it on, and I'm going to take each layer off. This is a demonstration of a modified Robert Jones bandage with the application of a spoon splint, okay, on a dog. So first I'm going to take my spoon splint and I'm going to just measure it up, make sure it's the appropriate size spoon or splint, and yes it is. Okay, it's a good fitting splint for the dog. So now I want to apply my stirrups to the dog's leg. I'm going to apply the tape to the dog's leg, just like I did in the previous video, attached to the end of a tongue depressor. Follow up on the other medial part of the leg, tape to the dog's leg, and attach to the end of a tongue depressor. Okay, straighten that out. Okay, so we got our stirrups on there. Now our first layer wrapping is going to be our cast padding, and like our previous video, we want to go from wrap from distal to proximal, leave 2 nails exposed so we can check for any swelling of this bandage. So I'm going to start down here, and I'm going to overwrap by 50%, applying some pressure, not a lot of pressure because I don't want to cut surface. Next layer is going to be my conforming gauze. Same principles apply. Start distal, overlap 50%. Bring my stirrups up. Okay, so now I'm going to apply my spoon splint. I'm going to, the pad of the dog sits in the spoon part of the splint, and I'm going to secure the splint to the dog's leg with some tape, applying some pressure, not too much. And I'll use, on this size dog, I'll use 3 pieces of tape. Okay, last piece. Okay, again, same rules apply. Starting distal, working my way up proximal, and overlapping 50%. Now when I get to the top, just like in the previous demonstration, I'm going to leave some of my previous layers exposed. This is a demonstration of the removal of a modified Robert Jones bandage with the spoon splint. Okay, so I'm going to remove the bandage in reverse of how it goes on. This is a demonstration on applying an emergency abdominal bandage to obtain hemostasis. So here's our dog. We're going to pretend that the dog has an oozing abdominal wound, like right here where my glove is. The first thing we're going to do is put our primary layer on. More or less, we're going from layer 1 to 3. So we have bleeding happening in the abdominal area, so I'm putting my bandage over that right here, and now I'm going to apply pressure, put a pressure bandage on, and I'm just simply going to use vet wrap. I'm going to go around the animal, and my pressure is going to be in the abdominal area, not on the spine. I want to put the pressure in the abdominal area. I don't want to create any wrinkles in my vet wrap, but when I go underneath the stomach, I'm going to apply a little bit of pressure and go over the spine. Don't want to put the pressure here, I want to put it underneath here, because our goal is to reach coagulation so that we can stop the bleeding and ultimately save the dog's life. Again, okay, and that would be how you would apply an emergency abdominal bandage to a dog with an oozing fluid, blood, whatever, so that we can take this and get this dog fixed up. Dog coming into the emergency room, and we're going to triage them. So first thing we want to do is look at the eyes. I want to check for pupils, for symmetry, and make sure they're not fixed and dilated. I want to look at the conjunctiva. Then I'm going to look at the mouth. I'm going to open up the mouth and make sure there's nothing lodged in his airway. And while I'm in here, I'm going to look at the gums, checking the color and the consistency. I'm going to do a CRT. And I'm also checking for denting. I'm going to do a quick skin tint test for dehydration. Okay, then I'm going to feel the animal all over. All the while I'm watching the mentation of the animal. We're pressing all over. I'm going to pick up his extremities. Now I'm going to listen to his lungs quickly. Check the breathing. I'm also listening to his heart. See how fast or slow it's beating. Okay. And then the remainder of the time while it's in the room, we're going to watch the behavior and see what kind of behavior the dog will be exhibiting. This is a demonstration for basic first aid on a laceration on the distal limb on a dog. Okay, here is my simulated laceration on the dog. And the first step is I'm wearing gloves to prevent contamination to the wound and from the wound to the environment. The second step, I'm going to apply sterile lube, which is a water-soluble lube, and I'm going to apply it to the wound. And the reason why I'm doing that is because the next step, I'm going to clip the hair around the wound, and I don't want any hair to go into the wound and contaminate it. So the next step would be I would clip the hair around the wound. The next step is I would take either a 22 blade, surgical blade, or some scissors, and I would clip the wound edges out. The next step is I'm going to clean around the wound with chlorhexidine, a diluted chlorhexidine solution, a 1:40 dilution. Now, the next step is the lavage. The lavage solution we can do a few ways. We can use an isotonic solution, a warmed isotonic solution, and we can hang an IV bag and attach a line to it to a syringe that is a 35 milliliter syringe attached to a 19 gauge needle. And the reason why we use that system is because that provides the correct pressure needed to lavage out that wound. With the right pressure, it will clean it out. And that pressure is 8 to 12 psi's, okay? Or we can just simply use a warm water with a little bit of diluted chlorhexidine in there in the syringe system like I just mentioned. Really important is we use a copious amount of this because we want a lot of fluid to run through this wound to clean it out. That's assuming I was lavaging, I would be pressing down on this and cleaning out and repeating this process. And now it's time to apply the bandage. So the first step in doing so is I apply a topical antibiotic cream or ointment to my wound. Then I am going to apply my stirrups to do a modified Robert Jones bandage. Then I'm going to apply a non-adherent, non-occlusive wound dressing to the actual wound to cover it. That's going to be my primary layer. My next layer is going to be cast padding. Now I'm going to wrap from distal to proximal, and I'm going to allow the two nails to actually be exposed still so I can check the wound for swelling. My next layer is going to be my conforming gauze. Now the next step is to turn the stirrups up. Okay, now my last wrap, final layer, is going to be my vet wrap. Going to leave the top exposed like we did in our previous Robert Jones, modified Robert Jones. So the final thing we're going to do is add a piece of elasticon to the bottom to act as a shoe, more support to the dog as they're walking with this modified Robert Jones bandage. So we add one piece of elasticon. Okay, we have
Later down, not
we have Lula here. We're going to do a dental on her, and our first part is to evaluate her teeth. And we have a chart here that we fill out, and we're going to indicate whether she has any missing teeth or are there any loose teeth that perhaps the vet needs to pull or needs to look at, and we're going to indicate that as well.
Is it sutures?
Isoflurane
Yeah, this is for state.
with a cup tubing. Little inspiration. This is our dental pack.
Say that in more.
Mhm.
Can I borrow you a second?
Initially, we're going to use a hand scaling tool, and we're going to remove any plaque or tartar that we can initially. And then our next step is going to be an ultrasonic scale.
Mm-hmm. Don't know if she's been on any antibiotics or not.
Said that.
That's not antibiotics, that's pain and inflammation.
It's just skin. It's all skin.
Yeah, but see, that's the,
I also want to
that's
use
the other end of that.
Particular one.
Mm-hmm. I don't really wanna cut that. She was just trying to do it herself.
No, she loved it. She just, like, we all wanted the ears a little shorter, and I should have, she should have just asked.
Right now, it's time to do the ultrasonic. And what we want to do with this is we want to make sure we go with on the side and not stay on the tooth for longer than 10 seconds because it does provide a lot of heat.
Right.
Are you free for a second?
And dry it as Next step is going to be some coffee-based polish with some white fluoride in it. I'm going to put a little bit in my polisher, as well as on the tooth that I'm going to be polishing. So now I'm going to be polishing the tooth so I stick any with some fluoride, like putting fluoride taken off and polishing them for any abrasions that may have caused from the dental.
Yeah.
So the last step we're going to do is rinse and rinse the polish out nice and polished. So a message for the owner of this animal is to have this animal's annual dental done, which is always great to indicate if there's any problems happening, as well as to 2 or 3 times
Fifth grade,
a
that's how old?
week to try to brush the teeth with a pet-based
toothpaste, and also dental chews would help, as well as a hard dog food would help with taking care of this dog. Fantastic.